Automated external defibrillator, or AED, is a device that can diagnose and treat potentially life-threatening cardiac arrhythmias through the application of electric shock. Automated external defibrillators come in a variety of models, either fully automatic, which will deliver the shock without any commands from the user, or semi-automatic, which will inform the operator if the shock is indicated and when to deliver the shock. These icons represent the individual steps for managing cardiac arrest using an automated external defibrillator. Pay special attention to them. Determine whether the patient is a candidate for an AED. When you arrive at the scene, quickly examine the patient for breathing and determine whether the patient is a candidate for an AED. Use of an AED is indicated if the patient is unresponsive, apneic, and pulseless. Use of an AED is contraindicated if the patient sustained severe trauma that caused cardiac arrest. Provide CPR and power on the AED. The other emergency responder should immediately start the CPR while you turn on the AED. After a quick assessment, the other emergency responder should create a patent airway with an oropharyngeal or nasopharyngeal airway adjunct, and ventilate the patient with a bag valve mask. Continue with CPR at a ratio of 30 compressions to 2 ventilations with the oxygen set at 15 liters per minute. Question the bystanders about the arrest event. While performing the CPR, ask the bystanders the history of events and how long the patient has been unresponsive. Attach AED pads to the patient. Before attaching the AED, remove any electrically conductive materials that are in contact with the patient. Remove the backing from the pads and attach the AED pads by placing the top right pad below the right midclavicular area and the lower pad over the lower left ribs in the mid-axillary area. Ensure all individuals are standing clear of the patient. Give an order to stop CPR and ensure no one is in contact with the patient. Give the order all clear. Initiate analysis of rhythm. Press the analysis button and wait for the machine to analyze the heart rhythm.
Analyzing.
Press the shock button. If shock is advised by the defibrillator,
Shock advised.
visually check to ensure that no one is in contact with the patient and press the shock button to deliver the electrical shock. Perform CPR. Following the shock, immediately continue chest compressions. Perform CPR for 5 cycles or 2 minutes unless the patient regains consciousness, moves, or begins to breathe. Reanalyze the rhythm. Advise all individuals to stay clear of the patient and reanalyze with the AED.
Analyzing.
If shock is indicated,
Shock advised.
again give the all clear command and press the button to deliver the shock. If no shock is indicated, immediately resume the CPR.
No shock advised.
Check the carotid pulse during CPR to confirm the effectiveness of the CPR. Reevaluate the patient. Check the carotid pulse and reanalyze the heart rhythm with the AED device.
Analyzing.
Continue the resuscitation cycle. Ensure that everyone is clear of the patient. Reanalyze the heart rhythm. Shock if advised. and continue CPR for 5 cycles. After 3 shocks, prepare for transport. Follow local protocols for additional shocks. If there is a spontaneous pulse, assess the patient for breathing. If breathing is inadequate, continue to ventilate with high concentration oxygen. If breathing is adequate, oxygenate the patient by using a non-rebreather mask set at 15 liters per minute. Transport the patient. Perform an ongoing assessment while transporting the patient.